mind. So I would like to talk to you first about those 5 myths that I hear all the time in my practice, and I call them the 5 myths about arthritis. And I'm going to start with the first one. You know, many people that do not deal with arthritis, they think that arthritis affects only elderly adults, and this is not true, because you know, in the United States, about 54 million people are living today with arthritis, and more people will develop arthritis over the next 20 to 30 years. And out of those people, about 7% they develop arthritis at a young age, and about 30% they develop arthritis between 45 and 64 years of age. But 50% of people that are over 65 years of age, they develop a type of arthritis. And unfortunately, more common forms of arthritis are seen in females than in males. And if you have to spread around the type of arthritis, about 1.5 million of people have rheumatoid arthritis. 3.2 million people have ankylosing spondylitis, but my belief is that these numbers are higher than what it is reported, because many patients with ankylosing spondylitis, they are very late recognized to have that. And especially females, they end up seeing the doctors very late in life or in the process of the disease. And that's why the diagnosis of ankylosing spondylitis or psoriatic arthritis, which is also a form of ankylosing spondylitis, is way under-recognized. And about 32 million people develop what we call the wear and tear arthritis or the osteoarthritis. So if you look at these numbers, not only old adults, but also young adults, they develop arthritis. The second myth is that there is nothing I can do about my arthritis. You know, once you get the diagnosis, a lot of patients will come to me and say, I don't think there is anything I can do for arthritis. And I have to say to them that that's not true. This is a myth. You can do a lot of things for your arthritis. And I start talking to them, you know, about the fact that yes, arthritis is a chronic disease. Yes, we cannot cure arthritis, but there are so many things that you can do to improve your arthritis, and especially the pain generated by arthritis. And I talk to my patients about diet, about exercise, about sleep, and about stress, and how all these lifestyle choices that we make actually impact arthritis to a big level, to a high degree. And the other myth is that diet doesn't influence arthritis. This is another myth again. And I talk to my patients about different ways. You know, medication is needed many times. And, you know, I'm not going to downplay the role of medication. But many physicians in our days do not talk to patients about lifestyle choices or lifestyle medicine. I call it a lifestyle medicine. We also call it integrative medicine. So that's why I want to educate myself, and I took this nutrition science course. And if you have the option, do it, because it's going to teach you so many things. But I wanted to be educated myself. Now, there is a huge correlation between, you know, the pain and the way that our brain sees the pain, but also the gut. You know, I talk to patients many times about this, you know, vicious cycle. If you have inflammation in the gut, that will cause an autoimmune disease, and that will cause more pain, and that could potentially cause an autoimmune arthritis. But if you are stressed, that is also linked to your gut, and your gut will develop inflammation, and you know that will affect the immune system. So our body needs to be seen as a whole. It cannot be seen just pieces, and we cannot treat just pieces. And that's what I emphasize all the time to my patients, because they are not one disease, or they are not a patient with a disease. They are a person, or they are people. They're not diseases. And, many times I talk to them about what they eat. And I do explain to them there are many studies that show that food, and this is more an extreme example, but food that is ultra processed or food that is chemically, changed will increase the weight of patients. And this is just a study from probably hundreds of studies that prove that ultra processed diet cause a rapid increase in the weight of a patient. And that rapid increase will translate into obesity, and obesity will translate into more arthritis. And obesity is also linked to cardiovascular diseases or diabetes or even depression. So that's why it's important what we eat. And many patients will ask me, so what is the best diet? Should I choose the low-fat diet? Should I choose to go to Weight Watcher? Or should I choose the cabbage diet? Fat or too much fat or no carbs? And there are so many books, so many blogs written about the best diet. But actually, I do not believe, or I tell my patients, or I educate my patients about looking at what they eat, not only as a necessity, but also think about food as a social event sometimes, and look at food as medicine, because what we eat is what we are. So I teach my patients about what is important to know about food and how should they look at food. And many patients will come to me and will ask me, so what should I use? What strategy is the best to use? Should I look at my plate and decide what to put on the plate? Or should I look at this as a pyramid? And I can tell you there is not a wrong way or a right way to do those things, but I think that it's also important what you put on that plate and how you address your needs, your nutrition needs. So the other thing that I talk to my patients is about intermittent fasting. I think that many people heard about intermittent fasting, but they don't know exactly how to do that or if this is beneficial or not. And the truth is that there is a huge benefit of adopting an intermittent diet. For some people, they cannot follow this kind of, I would say, this kind of approach. They could try other things for sure. But, when you look at studies that were done on intermittent fasting, it is proven that those people that approach their nutrition needs with intermittent fasting will end up with lower blood pressure and eventually lower appetite and increased insulin sensitivity, which will actually translate into less diabetes. And, I want to point out towards a couple of things that I feel like they're so important for people with any type of inflammation, autoimmune diseases, and also to people that suffer from arthritis. And one of them that should be eliminated from your diet should be sugar. And as you all know, now sugar is everywhere, in the ham, in the bread, in pasta, everywhere there is added sugar. So that's why sugar needs to be eliminated into your diet. On top of that, all the processed food, I would urge my patients to cut down initially and then avoid the processed food, because that is not only full of salt, which also affects the immune system, but it is also full in saturated fats, full in omega-6 fatty acids, and it has a huge impact on our gut microbiome. And as I said before, that will increase the amount of inflammation. Also, I talk to my patients about the bad oils. There are so many companies that advertise their oils as healthy oils, like the corn or canola or sunflower oil. They're all advertised as healthy vegetable oils. But in fact, when you fry your food with these oils, all the good fatty acids will transform into trans fats by frying. And that will make them very, very dangerous. And on top of that, the way that they are obtained using very strong solvents are also very detrimental to our health. So just to summarize things that you should avoid, number one, and I stress that on number one is sugar, number two, processed food, number three, trans fats. And I added 4 and 5 also to emphasize the importance of excessive alcohol that can cause inflammation to our gut, and smoking, which is actually linked to a lot of the autoimmune diseases, and especially rheumatoid arthritis. That's a connection that many people do not make, but I always tell my patients with rheumatoid arthritis, if they are smokers, to stop smoking, because smoking not only that will be bad for their health, increase the risk of cancer, but will also make them to respond to medication less, or to actually have more aggressive disease. Those patients that are smoking, they actually have higher disease activity than others that do not smoke. And I talked to them about anti-inflammatory foods. And this will be a lecture itself, but I just wanted to point out a few of important things that you have to know. Anti-inflammatory foods are foods that are proven to decrease inflammation. And when I say proven to decrease inflammation, there were studies done that measured markers of inflammation like IL-6, which is an interleukin that is proven to be elevated in people with inflammation, but also C-reactive protein. And I love berries, and I also encourage my patients to eat a lot of berries, because I'm going to give you a few examples, but blueberries, a cup of blueberries per day is proven to decrease inflammation. There are studies that show that the interleukin 6, which is again the marker of inflammation, will be decreased by adding a cup of blueberries per day, or 2 cups of raspberries per day, again, proven to decrease inflammation. And 50 grams of strawberries per day are also shown to decrease inflammation and decrease pain. Isn't that amazing? I mean, you just eat the right things and your levels of inflammation will be decreased. And people are also asking me about olive oil. I love olive oil and I recommend it all the time, but there are certain types of olive oils that you have to know are more beneficial. And I'm going to give you here an example. The cold pressed and unfiltered olive oil is the one that you should use or add to your salad. So on top of that, there are some studies that prove that using olive oil to rub on your joints, again, to massage it on your joints in the morning, it's actually as good as using an anti-inflammatory cream. So this is actually unbelievable. Just using olive oil to massage instead of using a cream with anti-inflammatory medication has the same effect. I do find this fascinating. Okay. And then patients will ask me which diet is good. The vegetarian diet was proven to work for patients with rheumatoid arthritis. And there are actually some studies done in, not very large number of people, but those people that were really strict about what they eat, and they eat only, vegetables for a short period of time, they show to have better outcomes than people that eat a regular diet. And I have so many things to tell you about the Mediterranean diet. I actually had another lecture where I talk about the Mediterranean diet and the benefits of Mediterranean diet. These are things that are proven. I don't have to stress on them, but I have to bring them in front of the patient. I already mentioned the benefits of the intermittent fasting, and this is a type of vegetarian diet. It's called the ITIS diet, but it also incorporates fish, into this diet. And it was tested recently in patients with rheumatoid arthritis, and it was shown to have beneficial effects. So the myth number 4 is related to exercise. A lot of patients will be very, very stressed about the fact that they will damage their joints if they exercise. And this is not true. The exercise does not cause arthritis, and the exercise does not make arthritis worse. And actually, exercise has absolutely great benefits for our health. Not only that will increase the muscles. Many patients will say, "Oh, I don't do exercise. I don't want to increase my muscle," but also it will decrease the adipose tissue, the visceral adipose tissue, which is proven to actually increase a lot of hormones. Those hormones will increase the appetite. So if you exercise, your appetite is less, you feel less hungry. And patients will ask me, so how much exercise is good, or how much exercise is needed to address my needs? And I say to them, any exercise is better than no exercise. If you can start from 5 to 10 minutes of walking and gradually increase this exercise to 30 minutes, obviously for every other day or 5 days per week, that will be great. That will be your goal. But nobody expects you to start here and actually get to 30 minutes every day. So that's why I say to them, progress is better than perfect. That's something that I discuss with my patients. The fifth myth, and this is the last that we're going to talk, is about stress. Is the fact that people don't even think that stress will affect their arthritis, which is not true. Actually, stress, as I told you before, is very well connected with our body, and our brain is very well connected to the way that we feel, and it's going to impact the pain level. And people that are under a lot of stress chronically, they end up having more inflammation and more pain. And again, this could be another lecture itself, but I just wanted to emphasize that chronic stress will lead to more inflammation, more depression, and more pain. And, what are a few ways of mitigating the stress? Many times I talk to my patients about how to incorporate mindfulness or breathing techniques, but even regular exercise, it's a way to address stress or to manage stress, or simple social interaction. If you interact with other people, if you meet your friends, if you make new friends, that could also address the stress level. And as I told you, I am a strong believer in mindfulness. I teach my patients how to practice mindfulness because I think it's such a cheap way of treating stress or treating pain. And I also talk to patients about another way of addressing stress or another way of addressing sleep. How many of you actually notice the fact that after a night where you don't sleep well, your pain is worse? Right? You have noticed that. And many of my patients will tell me the same way. They feel like sleep or chronic deprivation of sleep is impacting their level of pain. And this is true because it was proven actually that chronic deprivation of sleep because of pain or because of stress, it's actually going to decrease the immune system. It's going to increase your appetite, but your level of energy will be low, so you cannot exercise. You will end up in more pain. And actually, people that have pain for a long time and they don't sleep well also for a long time, they end up having other problems like diabetes or obesity. And I brought these diagrams to show you that insufficient sleep will lead eventually to disease and will lead to decrease in the immune system. And also patients that are under a lot of stress, they release some molecules that actually cause the sleep not to get too refreshing. So when you have chronic inflammation, that will also end up in causing more disturbance of your sleep.
rheumatologist OnCall.com